Hello and welcome to the third webinar in our Quick QI webinar series presented by the Excellence to Quality Improvement Project, or E-QIP. My name is Michael Dunn, and I will be walking you through taking a look at diagnosing the problem. This will be the first webinar in two webinars looking at diagnosing the problem. So our agenda for this session is to recap what E-QIP is, recap the model for improvement, which is really our roadmap to quality improvement work. We'll also take a look at the problem statement that we formulated in webinar number 2, and we'll start looking at the diagnostic tools. And in this webinar, we're going to look specifically at the Fishbone tool, the 5 Whys, and the Pareto. So by way of a recap, the Excellence Through Quality Improvement Project, or E-QIP, is a partnership initiative between Addictions and Mental Health Ontario, Canadian Mental Health Association Ontario, and Health Quality Ontario to support quality improvement within community mental health and addiction sector. And we're really building on the sector's already existing strong commitment to providing high quality, person-centered care to individuals and families in the province. And we do this through a wide range of offerings and supports, including quality improvement and data coaching, collaborative community of practice, education and training, and webinars like this one. In our previous webinars, we've talked about the 3 guiding models to quality improvement work. The one on our far right is that quadruple aim, and it's ultimately, where are we trying to get to as a health system? And that is to provide the best care for individuals possible so that they're happier and healthier and in the communities. We want to do this while supporting providers and staff and at as low cost, as efficient as possible. And in order to get to that quadruple aim, we have what we call domains of quality. Those aspects of care and service delivery that clients and families tell us are important and that lead to quality care. And those are things like equitable access, safe services, effective services, integrated system, being client-centered, and having access to services and supports in a timely way. And to help us improve those domains of quality, we have what's called the model for improvement. And that's our QI tool belt, as it were. And it asks 3 questions, which are, what are we trying to accomplish? How will we know that the change we make is an improvement? And what changes can we make that will result in an improvement? And whenever we do quality improvement and we build change ideas or create change ideas, we want to make sure to test those through plan, do, study, act cycles. Checking to make sure that those changes and that those ideas, once we test them, actually do result in an improvement and not make things worse or not do anything at all. We've also been going through the last 2 webinars looking at our example of Live Well Recovery Services. So I'll briefly recap that as we start down our diagnostic journey. And so this example is completely fictitious, and we're looking at an organization we call Live Well Recovery Services, and it's a community-based mental health and addiction agency that is in a mid-sized town in Ontario with a population of approximately 100,000. And Live Well Recovery Services has 3 locations and supports clients both in the city center, in the suburbs, as well as surrounding rural communities. And the complexity of clients served are continually increasing, but the agency offers a wide range of mental health and addiction supports. And one longstanding issue that Live Well Recovery Services has been facing is around access to, and specifically long wait times for, their intensive case management program. And they've received feedback through surveys and focus groups from clients that tell us that this is a big challenge, wait time for intensive case management services. And it's been something that's been set as a strategic priority for the agency. The program manager of the intensive case management program took a look at the data for wait times and noticed that over the last 2 years, there's been a steady increase in wait times for service. And most recently, the wait time is up to 108 days. And this is obviously not ideal, as it's requiring clients to wait an awful long time to get service. Taking a look at that wait time data, and this shows us that blue line, that's the average numbers of days waiting. You'll see that, as indicated, that wait has increased over the last 2 years, bringing us to our point of about 180 days, or 108 days, sorry, at present. So in our previous sessions, we took a look at setting up our quality improvement project team and the various roles that are essential as we start to think about tackling a quality issue. We introduced the project charter as really the one place to house all of our information around our quality improvement project, giving the reader a quick snapshot and keeping the team on track. And we talked about defining our problem and looking at a tool to do that, the 5W2H tool, which helps us come up with our problem statement. Today we're going to take that next step, that big leap into understanding the problem, which requires us to diagnose what are those causes of that problem that we're facing. And we're going to talk about 3 of the tools to do that today. And so to recap from our second webinar, that problem statement is really 1 or 2 sentences that identify and summarize that problem or issue that we want to improve. Provides a very clear expression of what the quality improvement team is setting out to achieve, but does not talk yet about solutions. And there'll be time to do that in our aim statement. And that fills in that little box right there. So the problem statement for our Live Well recovery services, if you recall back to the second webinar, was the wait time from referral, which is initial contact with the agency, to service initiation experienced by clients wanting to access intensive case management program has been steadily increasing for 2 years. Currently, clients that are referred into the program are on average waiting 108 days for service. Long wait times or prolonging periods of unwellness for clients, increasing stress and frustration felt by family members, and leading to overall higher complexity levels for staff when service does eventually start. So, congratulations, we now have a problem, a pretty clear problem. And having it framed this way allows us then to take the next step into diagnosing what are the causes of this problem. Why is this wait time increasing? Why is it so long? And then we'll look at what we can do about it. So we're tackling that second step in our model for improvement. Important to distinguish when we take this step, the differences between a symptom of a problem and the cause of a problem. A symptom is an indicator of a problem or quality issue, and these indicators may tell us that a problem does exist. But a cause, on the other hand, is the primary reason or reasons, and it's usually plural, why there is a gap between the existing state and the desired state. And so an example would be of a symptom. You have a very bad headache, so you take medication to help. And while that temporarily may help you, the cause, in fact, is that you're dehydrated, and the headache is merely a symptom of that dehydration. Another example is a symptom that the car's headlights are dim, so you change the bulbs. And this could be a symptom of a larger problem, that the car battery is low and causing the headlights to be dim. So it's important to make that distinguish as we delve into this part of our process. So the first tool in diagnosing and looking at our problems the causes of our problems rather, is what we call the Fishbone. And this is a tool that helps with what I call the breadth of all those contributing factors. So taking a look at all of those many things that are usually contributing to that problem occurring, because it's never usually just one factor. And so as you'll see, it looks like a fishbone, hence the clever name. And at the head of that fishbone, we put our problem statement. And then we come up with categories, and these are common categories, but you don't have to use these if there's others that make sense for you. We call these the 5 Ps. They are places and equipment, providers, people, processes or procedures, and policies. And we work with our team, and again, doing this as part of a large team, to come up with all of those factors within those categories that we think are contributing to that problem that we're experiencing. And so it can help us really think through all of those multiple things that may be contributing in some way to that problem, and it's not getting focused or stuck on one or two that are easily identifiable, but thinking about that wide breadth of factors. So if we take a look at the fishbone for our Live Well recovery services, this is what it looks like. So you'll see again in that head of the fish, we have our problem statement that we crafted in the second webinar, looking at our wait times and the unfortunate state of wait times increasing over the last 2 years to a point of 108 days. And then the team worked together with all of those members that we spoke about in the first webinar to come up with the many factors that they feel are contributing to that problem. So you'll see we have things like high rates of no-shows, inappropriate referrals into the program, duplication of data entry through the intake process, increased use of services than in the past, backlog of referral forms for intensive case management service. Intake can only occur on 1 site out of 3. Language and cultural preferences requiring specific case manager. Inconsistent application of eligibility criteria and referral processes between the 3 sites. Data entry delays into client management system, prolonging information required to book assessments of clients. Increasing demands on case managers to contribute to community education programs, thus taking them away from direct service. Not enough time for case managers to hold for assessments. There's competing demands. Lack of clarity on who manages incoming referrals. So is it reception? Is it case managers themselves? Is it intake? Policies prohibiting home community visits, requiring individuals to make travel arrangements for appointments. Lack of policies around coordination of vacation schedules of the case management team, and broad eligibility criteria for the program. So as you see there's many factors contributing to this problem, any one of which we could tackle for improvement. So we're going to put that on hold now. We now have a wide breadth, and we're going to talk about the next tool, which is the 5 Whys tool. And so where the Fishbone gives us that breadth, all of those many factors, the 5 Whys tool is really a depth tool. So taking any one of those factors on that fishbone and diving deeply into it to understand, is this a symptom of a problem, or is it actually a root cause of that problem? So we start with the statement of the problem, and we ask why this problem is happening. Why are we experiencing this? And we ask this question over again for, we suggest about 5, but maybe it's 3, maybe it's 7 whys, until we get to a place where we don't feel we can go any further. We also don't want to put blame, so we don't want to ask the question, okay, why is this wait time happening? Well, it's because John is working intake. That's not going to be helpful. We want to avoid personalization, but come to something that's actionable and reasonable and within our sphere of control. And so it sounds really easy and straightforward, but believe me, it's not as easy as it sounds. So here's an example from the sector that you may or may not be familiar with. And that is, in a court support program, staff noticed that individuals with mental health needs were ending up in crisis at the local correctional facility soon after they arrived, which is not good. So the team took a look using the 5 Whys tool and asked, well, why is this happening? And they found out that many individuals, when they went from court and were taken into custody and arrived at the correctional facility, were not receiving their medication while they were in custody. Well, why did they not receive their medications when they were in custody? Well, they did not receive an assessment when they arrived at the correctional facility. Then asked, well, why did they not receive that assessment? The psychiatric correctional staff did not know about the issues that the individual had. Well, why didn't they know? Those issues that were flagged in court by the community mental health and addiction agency staff, the court support staff, were not communicated to the psychiatric staff at the jail. Why were they not communicated? There was no process in place or dedicated person to communicate between the court and the correctional staff. So again, you can see we started on something that was fairly broad, and we came to a place of something fairly actionable, which is one of our root causes. So again, taking a look at the 5 Whys as they're applied to our Live Well recovery services, it looks like this. And so we picked one of those root causes identified by the Fishbone that I mentioned. And in this case, the one that we chose to focus on is there's not enough time for case managers to hold for assessments compared to the pace of referrals coming in. So that was identified on our Fishbone. And now we want to understand, well, why is that? Why is there not enough time for case managers to hold for assessments? And answering that first why, well, there is an increased use of service, more frequent appointments, longer appointments than has been traditionally experienced by case managers of the program in the past. Well, why is that the case? Some clients that are accepted into the program require higher supports than is appropriate for the program. So staff are having to spend a lot of time with one client, perhaps. Well, why is that the case? There is an inconsistent approach between case managers of applying the eligibility criteria when assessing an individual that is referred into the case management program. Why is there that inconsistency? The eligibility criteria is broad, open to interpretation, and perceived as outdated. Well, why is that? The program has not reviewed the eligibility criteria since the program inception 10 years ago. So again, we're drilling down deeper and deeper into that bone on our Fishbone that we identified as a cause to make sure that we're not dealing with a symptom, but rather we're dealing with a true root cause. So the third tool that we're going to talk about today is called the Pareto chart. And so it works very well in tandem with those other two tools, the Fishbone and the 5 Whys, to help us narrow down all of those multiple factors that we've identified as contributing to a problem and landing on what we call the vital few. So we're trying to look for that 20% of causes that leads to 80% of the problem that we're experiencing. It's what we call the 80-20 rule. And again, identifies the root causes that make the greatest contribution to that problem. And how do we do that? Well, we start by calculating the cumulative contribution of each of those causes, starting with the greatest down to the least. So this is what a Pareto chart looks like if we draw one out, and there's a great template available for you on the E-QIP collaborative community of practice, so that for all of us who don't love graphing and math, all we have to do is put in our root causes from our diagnostic tools, our Fishbone, our 5 Whys, and it'll help us do the rest. And so what you'll see here is all of those root causes. And in this case, the example that we're looking at is clients not attending a Clubhouse program. And so we have all of the causes arranged along the bottom for why folks are not attending our Clubhouse program. And we arrange them from the greatest down to the least. And in this case, we had some data available through a survey to tell us why clients were not attending the Clubhouse program. So what we did was calculate took all those surveys and looked at the results and found those reasons that people identified in the surveys most frequently down to those that they identified least frequently. And we arranged them in that order. And sometimes you might have data available. So you may have survey data available. You may have data available through a tool or your client documentation system to tell you the causes of a problem and the frequency. So for example, if we had clients of a particular program going to hospital and we wanted to reduce that, hopefully in our documentation notes we'd have the reasons why folks went to hospital, and we could look at the frequency of those reasons and arrange them like this. What we can also do sometimes, if we don't have access to data, but we have a number of root causes identified through our Fishbone, is we can actually have the teams vote on which causes they think contribute the most to our problem. Again, so we're ending up with some semblance of which root causes are more frequent, more popular than others. And once we have that, we can arrange it on our Pareto like this, from the most down to the least. And what we're looking for is that 80% line. So we want to get identified 80% of our problem and tackle those contributing factors that lead to that 80%. And we do that through calculating that cumulative percent. So you'll see that 80% line and that pink line, which is our cumulative percentage, intersect. And where they intersect, we want to take a look at everything to the left of that intersection. And that's going to give us 80% of the identified reasons why people were not attending our Clubhouse, and save us from focusing on those other factors that only contributed to 20% of people not attending the Clubhouse. So we're trying to focus our efforts on those factors that have the biggest impact on our problem. So we're not wasting time on things that maybe don't impact that significantly. So it can be very helpful to help us prioritize our efforts. We call those the vital few, as opposed to the trivial many. So taking a look back at our good old Live Well Recovery Services example and our Pareto chart here, you'll see that the team took those bones from the fishbone, all of those contributing factors to our problem, and arranged them after an exercise of voting, so asking all of the team members to vote on which factors they thought or they experienced as contributing the most to that problem, that high wait time problem, and arranging them on our Pareto chart from those with the greatest number of votes down to those with the least number of votes to identify our vital few versus our trivial many. And you'll see it's, again, everything to the left of that 80% cumulative percent where we want to be focusing our efforts. So in this case, it's factors A through E versus the trivial many, which is F through L. So if I'm looking at my list of root causes, I would be wise to, again, focus on that A to E, so inconsistent application of our eligibility criteria and referral process between 3 sites, looking at time for case managers to hold assessments, and so on, instead of focusing on those things that show a little impact, such as lack of policies around coordination of vacation schedules, because maybe that's not a big contributing factor. And so, having walked through the fishbone, the 5 whys, and the Pareto, it can help us to take our problem statement and determine what are those factors, what are those root causes of this problem, and help us to prioritize those from those contributing factors, those root causes with the biggest impact, and those that maybe don't have a very big impact at all. And this will further help us as we decide upon our change ideas and our improvement efforts so that we don't waste our time. I hope you've enjoyed webinar number 3 in our quick QI webinar series. And I would encourage you to reach out if you have any questions, like more information, or any comments. You can reach out to myself, Michael Dunn, my colleague Debbie Bang, or Jenna Hitchcox, our program manager. You can also join our E-QIP mailing list by visiting the URL on the right and receive all the latest news and information and resources from E-QIP so that you can stay informed and be part of the excitement of QI. So until next time, thank you very much for joining, and we'll see you on webinar number 4.